Hi, my name is Aaron Bitter, and I'm a social work grad student at University of Texas at Arlington. This is a mock-up of solution-focused brief therapy. I'm here with my client, Cindy. This is our second session out of 4 individual sessions. Cindy is also seeing me for group therapy as well, once a week. And so, Cindy, are you ready?
Yeah, I'm ready. Wherever you are.
How are you doing today?
I'm okay. How are you?
Pretty good.
Yeah.
So, the last time I saw you was earlier this week in group therapy. Mm-hmm. And I want to thank you for participating in group.
Thanks.
So, if I'm correct, that was your 4th group session, is that right?
Yeah, it was my 4th one.
Okay. And how do you feel like the group sessions are going for you right now?
They were honestly a little bit hard at first, opening up, but everybody's pretty accepting there. So I've started to I think they're helping.
Okay.
Yeah.
And so, so we started the group therapy. When you started the group and seeing me, you had just gotten out of residential treatment. That's correct?
Yeah, I was there for 28 days.
28 days. And since I saw you last, have you continued to maintain your sobriety?
Yes, it's the 28 days helped, the group therapy helped, so I've been able to maintain that. I mean, it's kind of like an everyday struggle, but I'm doing okay. Okay,
well, on a scale of 1 to 10, I guess how would you rate if 10 is the most challenging possible situation you've ever had in your life, and 1 is that this is just really easy?
Okay.
What would the number of how challenging it is be for you right now?
I mean, I would say it fluctuates a little, probably like a 6 or a 7.
Okay.
Yeah.
And so what would it take? What do you think needs to happen so you can get that number down to make it less challenging? What are those steps that you feel like you need to take?
Okay, so to get it down, I think I would, I need to keep doing what I'm doing. I need to get more comfortable with it, keep the therapy going. It helps having a support system, and I just need to take steps to get my life back on track. I want to, get to a place where I'm happy in my situation, accept the changes, and kind of just, take that next step to getting my life back on track.
Right. Well, and I think you're doing great. I mean, you're going through a lot right now. Mm-hmm. I know we talked about the loss of your mom recently.
Yeah.
You're going through a divorce.
Right.
And you don't have your kids with you.
Yeah.
So you're doing great. I mean, you're obviously doing something right as far as coping. Mm-hmm. And I know it is challenging, but what are you doing? What is it that's working for you? What are the coping skills that you're...
For coping, I mean, this is all pretty new to me, but, definitely having that support system, having our sessions, the first one helped, I have a sponsor now, so being able to call that person, whatever time it is, and talk to them is helping. Healthy activities and keeping myself busy, staying busy.
Well, I'm glad that you got the sponsor. We talked about in our first session when we talked about goals.
Right.
One of the goals we talked about was you getting a sponsor.
Yeah. And so it's helped.
That's great. That shows that you're taking this seriously. Mm-hmm. Getting a sponsor can be a challenging just to break that. So, are you seeing how that's helping you?
Yeah, it's helping a lot. It was kind of weird, like asking someone to be my sponsor, but they're really like welcoming and accepting, and we keep in touch every day, and I can call her night or day, and she's there. So it's definitely helping a lot.
That's great. And we talked about other goals where I know you told me you were struggling with everything you got going on to get to. I wanted you either to go to meetings or church or to some form of community support.
Yeah.
How is the progress with those goals going?
Well, so my sponsor is actually going to meetings with me. I haven't made it to where I'm comfortable kind of going back to church. I did that a lot growing up. I'm not there yet, but my sponsor, she gave me a list of meetings, and she goes to some with me, or if I'm having a rough day, like I can go to as many as I want.
Yeah.
Yeah.
Well, no, so, a lot of people I work with, they have no experience in recovery.
Yeah.
And for you do. I mean, you have 12 years of sobriety that you had before this last slip up.
Yeah.
So, can you tell me about how it worked, how things worked for you back then? Like, what was it that you did when you were sober back, before this slip up?
I mean, so my life was a lot different. Like, I had my routine down, Every day my husband would go to work, I had my kids, I would have dinner ready every day. I had my set schedule, I had my friends that I saw on the weekend. I had that structure, that stability, and then when things started to get a little bit rocky is kind of when things got messed up.
Okay. But that structure, that was very important in terms of your recovery program before.
Yeah, it's what helped me just kind of stay on the right path. Every single day I just knew what to expect, and there were no really crazy things happening, so the structure just helped on a day-to-day basis.
Okay, and so right now I'm going to guess that you're feeling a lack of structure right now. If you were to rate the level of structure that you have in your life right now, where do you think that 10 being where you want it to be the most structured, and 1 just being complete chaos? Where do you think you're at in terms of structure?
Well, we stepped away from the chaos, but I'd say that we're still at a 4, probably. Okay. I mean, my days still aren't laid out super specifically, so I'm ready to get to that point.
Okay, so 4 now. Now, when you were in sobriety and recovery before, what would you say the number when you were
like a 9?
A 9. Okay.
Yeah.
Do you know, and I think you do, what it's going to take, what it looks like to get back to that point?
Yeah, I mean, just clear thinking, making the right choices, doing the right things. I'd love to have my girls back in my life. I think that would help a lot. It's been kind of hard life without my husband, so then I'm just relearning everything. And so, getting used to it and kind of planning my days out beforehand so I know what to expect, so, I don't mess up.
Okay, so what I want you to work on between now and our next session will be 2 weeks from now.
Okay.
So I'm only seeing you individually every other week. So, one of the things we've talked about is needing to do some work in between.
Yeah.
So I'd like to, as far as a goal between now and the next time I see you, is to actually to work on the planning. I want you to actually start writing down or typing up a plan. I want you to, whether it's do you think a daily plan would work good for you?
Yeah. So just like a daily schedule.
A daily schedule, yeah.
Okay, I can do that.
Yeah, so I want so that's the goal is to achieve planning, and we're going to do that by you actually is coming up with a daily schedule. I want you to try to do that each day.
Okay.
And I know time is you don't have just all
the
world of time, but you told me that when things were working right for you in your life, that routine and structure were important.
No, it's true. Yeah, I can do that.
Okay.
Yeah.
That makes sense to you, what I'm asking for?
Yeah, I think it'll help a lot, and it'll kind of get me to focus on, too, like, what do I need to do during my day, or what do I want my day to look like? So, yeah, that'll be good.
Okay. And one of the things I know we talked about, it's come up, actually, in group more so than individual, is that this seems to be your big thing, is when I watch you participate, I hear less about the cravings or the this or that related to alcohol. What I'm hearing is that you're struggling with being alone. Is that a fair statement?
Yeah, definitely. I mean, my whole life has been my kids and my husband, and now I don't have any of that, so it's uncomfortable.
Yeah.
So I don't really know how to do that.
Okay, and obviously your goal is to get your kids back in your life, and you're working on that, I believe, towards doing the things that we're talking about in group. I mean, maintaining sobriety, which is a goal in itself, is going to ultimately lead to you getting your kids back. But as far as sort of you're learning how to live again, is that what you're saying?
Yeah, I mean, it's a whole new life. It's totally different, and I want to make that life a happy life for me and my girls. So, everything was kind of circulated around my husband, so I just need to, find out about myself now.
Yeah.
Yeah.
And I know it's a different place. I mean, for you to go back to when the last time you were alone, it's like you were a kid.
Yeah.
Right? I mean, you were, 19, 20 years old?
Like 19. And it's been so long. Like back then, I don't even remember it. So.
Yeah. Well. Yeah. I mean, I think that when you were at that age, from what you've told me, though, you were a very independent 19-year-old.
Yeah, definitely. I mean, I was happy, independent. Yeah.
So I think you know what it takes to be happy and be alone. It is sort of relearning that.
It's just different. I mean, it's kind of uncomfortable, but everybody in group, they understand. They've been through similar things, so that's helping a lot too.
Yeah.
Yeah.
So a lot of, I think, is also acceptance. You're accepting that right now this is your situation.
Yeah, I need to just accept it for what it is, so, and do better.
Okay. You feel, I know that, do you see progress? I mean, I feel like just from, I've observed you in group just in these last few weeks that, while you are struggling with being alone, I see progress. I mean, do you see it in yourself?
I mean, yeah, it's hard. I guess it's harder for me to see because I'm used to being right here, and I'm not. But I'm used to having my girls every day. So I think once I'm able to even be around them again, that'll really be my like, I know I made it.
Yeah.
Yeah.
And I guess what I want to know is what happiness, what it looks like for you right now. You've got all this going on with the obviously the relapse and dealing with coping with your mom.
Yeah.
The divorce. If there's this thing that we do in the therapist, this tool that we use. It's called the miracle question. Have I told you about it?
No.
So the miracle question is, it might sound, the first time I heard it, I thought it sounded kind of cheesy.
Okay.
But I know that there's some power in it, and I've seen where clients are able to use this to help them. So what I want to ask you is, if you went to bed tonight, and when you everything, you have the stress that you have in your life, what's going on right now, when you wake up in the morning, the problem is solved, and your life looks everything that you wanted.
Yeah.
You got everything, all those things you were stressing about, they're all gone, and life looks like what you want to look like. What would that look like?
Wow, that's a loaded question. Okay, so I wake up and everything's perfect.
Everything, the problem is solved.
All right.
What does that mean for Sydney?
Oh, man. Okay, where do we start? Well, I'd obviously have my girls back. We'd be, in a house that's comfortable for us. I have a job that I can spend. My girls are out of school weekends. I'd be with them. We'd be happy. We wouldn't need really a man around because we have everything taken care of. We'd have a dog.
Yeah.
We just be happy. I just up with my girls. We go to the movies, hang out, go shopping, and just, whatever we wanted to do.
Yeah.
Yeah.
Well, I mean, I think those are great. That sounds happy to me.
Yeah.
And so I want you to think about what you just told me. I want you to keep that in mind. That if what the miracle looks like is you having your daughters back in your life, not being reliant on a man.
Yeah.
Does sobriety, does that figure into the not thinking about not having that desire to drink? Is that?
Yeah. I mean, it's pretty. I did it before, and I think everything else that's going on is just making it a little bit harder. But not ever having to wake up with that desire to drink, like that's what I need. Yeah.
Okay. Well, I want you to focus on just what you can do to what you need to do to get there, and to keep your eyes on that. And something you might even write down what we just talked about. That
when I'm writing my plans.
Yeah, this is where I'm trying to get to.
Okay, I could do that. Yeah, because then I could do like a daily reminder or something.
Exactly.
Yeah.
And I think that you're strong enough to get there. You deserve happiness, don't you?
I mean, everybody deserves happiness, but it's just that's kind of hard to go through when you make those mistakes.
Yeah.
You know what I mean? When things are as messed up as they've been, like, you're not supposed to make mistakes with your kids.
Yeah.
So it's kind of hard.
I understand.
Yeah.
So you're feeling some guilt about those mistakes?
Yeah.
I know that your husband is maybe a little bit of a pain point, but I want you to think about feeling grateful that when you went through that situation, that you do have him, that he's able to be there for your daughters.
Yeah.
That might help you with some of the guilt. I mean, the situation, while you might have made a mistake that led to this, your daughters are safe right now.
Right. Yeah. Yeah, he's a good dad. So, yeah.
Okay. And other goals that we talked about, what I wanted you to think about, what we talked about the last time I saw you was, we talked about goals that we set some goals together.
Right.
But I also told you I want you to think about coming up with some goals on your end, on your own.
Yeah.
Did you think about that?
Yeah. And I mean, they're pretty simple.
That's fine. Simple's fine. Simple's good.
So goals, I want to, obviously my girls, that's goal number one. I want to be able to set healthy patterns. I want to get my structure back. I want to have that job that I can have, be back working. think that'll help me not feel so lonely.
Yeah.
And get a place for my girls. And I want to keep working the program. I want to keep. I got a sponsor, and that was on the list.
Yeah,
so I'm
job.
getting there.
Yeah. I said, you're doing great.
Okay.
There's
Thank you.
A lot of people that would be. You're going through a lot. Let me say that. It's it would be easy to. It would be easy to throw in the towel for some people. You're a very strong woman.
Thank you.
And I'm seeing where you get that strength from. It sounds like that desire to be that mom that your children need.
Yeah.
And that strength that's what's going to get you to where you're trying to go to. Okay. So I really feel like you're working on the things. Checking yourself into rehab a couple months ago. Again, that in itself.
Yeah.
You didn't have to do. Nobody held a gun to your head.
Right.
And said, "You've got to go to rehab, Cindy." Nobody said that.
Yeah,
that took courage. That took a want to actually to work on yourself.
Yeah.
You see that, right?
Yeah, it's kind of embarrassing, but yeah.
Embarrassing, is if you continue down that path and didn't do anything about it.
Right.
I understand that you feel a little embarrassed. But,
yeah. If this hadn't happened, maybe, Joe and I would still be together. But so it's just working through that.
Yeah. Right now that's not the case.
Yeah.
And so have you thought about one of the other things we talked about in our initial session was that what I wanted for you was to not just work on these things in group counseling and work on these things with me, but that we wanted to get some tools in place for that broader picture of how you were going to apply that to your life going forward.
Yeah. And my sponsor kind of helped me with that, but it's kind of what we talked about. So getting there, just doing the little things that I need to do, daily plans, making my plan and sticking to it, just kind of going from there, unless there's something else that I should be doing.
No, that's
yeah.
What we want is we want progress.
Right.
I want to see progress in the group therapy. I want to see progress from week to week. When I see you, every other week, I'm hoping for progress.
Right.
Progress. I can't. I'm not expecting you to get to solve the world's problems today. I just want to see that each time I see you, that you're a little closer to where you want to go.
Yeah.
And I think that's what I see. What I see is progress.
Every day gets a little bit easier. Feels a little bit better.
Okay.
So I feel like we're getting there. I think we're getting there.
Yeah. And so something I told you I like to do, sort of the same thing we do in our group sessions.
Right.
At the end of group, I know, you guys are looking at your watches sometimes, but what we like to do at the end of group is that we, I ask each of you guys to go around the room and tell me what we learned today, what you got out of today's session.
Okay.
I want to know what you've gotten out of this afternoon session.
We it helps feeling like I'm going in the right direction. I always feel a little bit better about life. Learn that it's okay to make mistakes because they're fixable.
Yeah.
So
yeah, they are fixable.
Yeah.
And so you're going to work on, as far as that goal, you're going to work on getting that daily schedule.
Yeah, getting that structure. I think that'll help a lot. It's going to help me be mindful of what I'm doing every day, so I can get back to where I want to be.
Okay. And was there anything else that things that you've thought about, something you want to talk about, or anything that you're?
Yes, we pretty much touched on it. I kind of wanted to talk about just structure. How do I get to that happy place? Because it's hard. You do something and you want to wake up and everything is great, but it's hard because it takes time.
Yeah.
So
I really think my job is to help you get there. It's not Aaron's job to decide what's right for your life, and I'm not going to be the one doing the work. I see my role as just helping you find those things, helping you find your strengths, helping you find the solution, and just sort of working. You find the goals that you're looking to find, that you're looking to reach, and we work together, to sort of to look at the solution. I know that again, I'm sure I drive you guys crazy sometimes in group because I'm all about positive recovery and positive therapy and solution.
It helps even on a bad day. It's good.
Yeah. Okay. All right. Well, just again, I'm glad you came in here today. I'm glad you're working on things. I see progress. And I guess I will see you in group next week.
I'll see you there.
Okay. Thank you.
Yeah, thank you.
And
Solution-based.
And so the again, that was solution focused brief therapy. See, I'm at the 20-minute mark, so I just the reason we use that model was for again, I believe in a very positive focus for recovery and trying to help clients find the solution and not dwell on the problem, and also the finite amount of time. This is not something where Cindy was going to have months and months and months to work on herself. So we use that approach, that limited time approach, and that's it.